Do you think broccoli is always good? That you can put it everywhere, in large quantities, without risk? Think again. In people over 60, small habits, how you store it, how you cook it, or what you eat it with, can transform this superfood into a source of fatigue, bloating, or unnecessary stress on the liver and kidneys. We're going to break this down with evidence and real practical advice. Stay with me. By the end, you'll know exactly how to treat your broccoli as an ally, not a trap. What I'm going to show you. In this video, you will discover why certain ways of storing and cooking broccoli ruin its nutritional value, what common mistakes cause inflammation, bloating, or force your liver to work too hard, and above all, how to correct all of this with simple actions, adapted to the needs of seniors. Bonus at the end, the gentlest method to keep broccoli a medicine and not a burden. Now, let's begin. The most common mistake, and one that seems innocent. Mistake shown. Storing broccoli for too long, or incorrectly. The common scenario. You come home, you put the bunch in the refrigerator drawer, and the week goes by. A few days later, the broccoli has lost its vitality, it's less green, and you continue to use it. Problem. Even before the head turns yellow to the naked eye, many vitamins are lost. Studies on the stability of vitamin C and other antioxidants show significant losses within a few days of cold storage. And worse, once the vegetable begins to wilt or smell a little old, microscopic fungi Aspergillus, Penicillium, Alternaria, etc., can proliferate and produce mycotoxins, invisible molecules that irritate the intestines and overload the liver if exposure becomes repeated. The literature on mycotoxin production during post-harvest decomposition is clear. The risk exists and increases when the produce is left to sit. What this means for us? With age, intestinal motility and local defenses can deteriorate. What went unnoticed at 35 can cause fatigue, nausea, or inflammation in a senior. Data on the physiological changes of the digestive tract as we age confirm this: slower digestion, less reserve, more fragility in the face of food toxins. The simple and medical solution: buy fresh broccoli, tight heads, deep green color, firm stems. Eat it quickly, ideally within 48 hours, a maximum of 3 to 4 days in the refrigerator if you store it properly. The losses of vitamin C and folate become really significant beyond that. If you want to keep it longer, wrap the bunch in a slightly damp paper towel, put it in the vegetable drawer in a ventilated bag, or leave the opening of the plastic bag slightly ajar. The idea is to avoid humid suffocation, which promotes mold growth. To keep it even longer, blanch for 1 to 2 minutes, submerge in boiling water, cool in ice water, drain and freeze in airtight bags. Studies on pre-blanched broccoli show good preservation of vitamins after freezing. Error #2 overcooking. We think we're doing the right thing. We want tender, easy to chew broccoli, so we boil or fry it for a long time. Result: you degrade vitamin C, some of the folate, and protective sulfur compounds, glucosinolates, sulforaphane, which are precisely the ones that support the liver and have anti-cancer effects. Studies comparing cooking methods show that boiling for a long time causes major losses, while gentle cooking, short steaming, brief blanching, preserves these compounds much better. But there's even better news. Some short or controlled cooking methods can even increase the formation of protective compounds or preserve the myrosinase enzyme. The nuance is technical but important. It's not raw equals good, cooked equals bad. It's how and for how long. In practice, how to cook effectively and gently for your body. Senior-friendly method. The golden rule. Steam for 3 to 4 minutes. Bright, green, still slightly crunchy. That's where you retain 80–90% of the antioxidants and active sulforaphane. If you want it softer, blanch for 30–60 seconds, then cool. Softer texture, limited nutrient loss. Avoid prolonged boiling, 5+ minutes, or prolonged frying. Significant losses of vitamin C and other water-soluble nutrients. A practical tip: Cover the pot and turn off the heat 30 seconds before the end of the cooking time. The residual steam finishes the cooking without overheating. Season after cooking olive oil, lemon, to improve nutrient absorption. Mistake #3 eating the stems raw or undercooked without preparing them. Many people throw away the stems or else some people put them raw in the blender for more fiber. The stems are rich in nutrients, yes, but they are also very fibrous, full of cellulose and compounds that are less easy to break down. In an older person, with slower digestion and sometimes less stomach acid or intestinal motility, large, unsoftened fibers can cause bloating, pain, or in some rare cases, complications, such as a partial obstruction, if large quantities are consumed improperly prepared. Reviews on digestive aging and the effects of insoluble fiber confirm that the form and cooking method of the fiber matter a great deal. How to turn a thick stem into an ally. A few easy steps. Cut the stems into thin slices, grate them, or finely chop them if you want to eat them raw. Smaller pieces are easier to digest. Better yet, cook the stems 5 to 6 minutes steamed or roasted until tender. Cooking softens the cellulose and releases the vitamins. University institutions, Harvard, etc., recommend light cooking to preserve vitamins and facilitate digestion. Avoid putting large quantities of raw stems in smoothies if you are prone to bloating. If you still want to blend them, pre-cook them for a few minutes. Is greater than. In the following sections, I'll show you other surprising mistakes, the worst food combinations, the problem of invisible pesticides, and the essential precautions if you are taking an anticoagulant or have a thyroid problem. I will also explain a simple 5-step protocol so that every bite of broccoli is truly a boost for your energy and not a source of fatigue. If you want to start right away, apply the 3 rules above today: buy fresh, store correctly, and cook gently. You will see the difference in your energy and digestion. Selected sources to show you where these recommendations come from. Studies on vitamin C loss and stability during storage and freezing. Review. Studies on the effect of different cooking methods, steaming, boiling, frying, on sulforaphane and vitamins. Work on the retention of bioactive compounds during freezing after blanching. Review on mycotoxin production during post-harvest decomposition to understand the risk of moldy vegetables. Reviews on digestive changes with age and the effect of insoluble fiber, bloating in sensitive individuals. If you want me to transform all of this into a voiceover ready to be read, rhythm, breaths, pause. Now we'll tackle errors 4 to 6, those that happen very often in kitchens but can cause real symptoms in people over 60. I'll speak directly. You'll understand why your stomach rumbles, why you feel heavy after a meal, and above all, how to avoid it with simple actions. Error. Eating raw broccoli when you have digestive problems. The raw equals always better myth is causing damage to sensitive people. Raw broccoli contains a lot of insoluble fiber and concentrated sulfur compounds, sulforaphane and others. In an aging digestive system, slower motility, less stomach acid, sometimes weakened mucous barriers, these fibers and compounds can irritate, ferment, and cause bloating, reflux, or a heaviness that lingers for hours. Reviews on the aging of the digestive tract clearly show these physiological changes. Slowing down. Alteration of mucosal defenses. Another point. Cruciferous vegetables are cited among the foods most likely to cause gas, not because they are bad, but because their fiber plus certain fermentable sugars feed intestinal bacteria and produce gas. If your stomach is sensitive or if you already have reflux, gastritis, or SIBO, eating them raw can make things worse. What to do? If you have reflux, frequent bloating, or gastritis, avoid eating large quantities of raw broccoli. Replace it with broccoli steamed for 3-4 minutes or blanched for 30-60 seconds. You'll retain most of the antioxidants and make the vegetable much easier on your stomach. Studies on cooking methods show that short steaming preserves significantly more vitamin C and protective compounds than prolonged boiling. If you want a crunchy texture, blanch for 30 seconds and plunge into ice water. You'll keep the crunch without the harshness on your digestive system. Small portions, small bites. Cut the pieces finely, chew slowly, and pair it with neutral foods, brown rice, avocado, or a source of healthy fats, olive oil, that soothe digestion. Mistake: storing broccoli in a closed plastic bag. We've all done it. We put the purchased broccoli in a plastic bag and straight into the fridge. Where it becomes risky, condensation forms inside, moisture stagnates, and you get an ideal environment for fungi and bacteria. The same logic that makes fruit mold in closed bags. Research on packaging and post-harvest preservation shows that high humidity and lack of air exchange promote microbiological deterioration and loss of quality. Why? This is important after 60 years old. Because mycotoxins produced by certain fungi are resistant to cooking and can accumulate in the body. The World Health Organization reminds us that many mycotoxins withstand food processing and that chronic exposure can affect the liver, kidneys, and nervous system. Since defenses decrease with age, the impact can be more pronounced in seniors. Simple, effective, how to store it correctly. Remove the broccoli from the opaque plastic bag. Wrap it in a slightly damp paper towel and place it in the vegetable drawer in a ventilated or partially open bag. The paper towel regulates humidity without trapping it. This is exactly what best post-harvest practices do. Control humidity and gas exchange to limit microbial proliferation. Temperature: keep it cool, 0–4 degrees Celsius if possible. Consume it within 2–4 days to retain vitamins and prevent mold. If you want to keep it longer, blanch for 1 to 2 minutes plus freeze. Studies on pre-blanched broccoli show that a large part of the vitamins and glucosinolates are retained after industrial freezing when the preparation is done correctly. Mistake: systematically combining broccoli with heavy dairy products. Cheese, cream sauce. It's delicious. I'm not denying that. But nutritionally, this combination can sometimes hinder the absorption of certain essential minerals. The calcium in milk and cheese can reduce iron absorption, single meal. Studies show acute inhibition. And in vulnerable individuals or those already close to a deficiency, this matters. Health agencies indicate that the effect is mainly visible at the level of a specific meal and may not dramatically alter long-term reserves in everyone. But for at-risk seniors, postmenopausal women, history of anemia, poor absorption, it's important to be aware of this. Practical consequences: regular and unbalanced consumption, broccoli plus large portion of cheese every day, can reduce the efficiency of iron and magnesium absorption during these meals. And a senior's sensitive body will feel it first: fatigue, cold hands, low energy. The good news: it's reversible and easy to correct. Smart alternatives. Separate meals rich in calcium from those rich in iron. If you're planning a broccoli dish, avoid adding a large cheese sauce at the same time. Leave 2 to 3 hours between them if possible. This is the strategy recommended by dietitians and researchers to limit the interaction within the same meal. Improve iron absorption. Add a source of vitamin C to the broccoli. A squeeze of lemon juice, red bell peppers. A tomato. Vitamin C increases the absorption of non-heme iron, sometimes very significantly. Replace the cream with more neutral alternatives. A drizzle of olive oil, mashed avocado, or a small spoonful of Greek yogurt in small quantities, and not at the same time as the portion richest in iron if you are at risk. These are solutions that maintain a creamy texture without compromising mineral absorption. Next, I'll reveal errors 7 to 10, the most insidious ones. Invisible pesticides and nitrates. Dangerous interactions if you're taking an anticoagulant. The goitrogen trap for the thyroid. And why you should never fix moldy broccoli by simply cutting off the damaged part. We'll also discuss the final, simple and safe protocol for preparing your senior-friendly broccoli. 5 steps, ready to follow daily. Now, we're entering the most delicate part. The one that very few people talk about. The invisible toxins, drug interactions, and hormonal imbalances that broccoli can cause. Not because it's bad, but because we forget that our bodies, after 60, no longer react the same way as they did at 30. So stay focused, because what you're about to hear can literally change the way you eat your broccoli for life. The next mistake: eating non-organic broccoli, loaded with pesticides or nitrates. You might be thinking, the common belief is, it's a vegetable, so it must be healthy. But here's the catch. Broccoli absorbs everything in the soil and water. Chemical fertilizers and pesticides penetrate deep into its tissues, not just on the surface. The result? Even with a quick rinse under the tap, some remains inside. A large study conducted by the Environmental Working Group in the United States showed that more than 2/3 of broccoli samples sold in stores contained pesticide residues, and about 1 in 10 exceeded the limits considered safe. Among these residues, organophosphates, substances known to damage nerves and strain the kidneys, and agricultural nitrates, capable of transforming into nitrites, which disrupt oxygen transport in the blood. Do you understand what that means? In the long term, your liver and kidneys work overtime to eliminate these chemicals. And if your metabolism slows down with age, these toxins accumulate. The result? Chronic fatigue, unstable blood pressure, digestive problems, and even liver inflammation. Some doctors report cases of seniors who appear to have a healthy diet but show abnormal liver function tests simply due to daily consumption of contaminated vegetables. But the good news is that a few simple steps are enough to eliminate up to 90% of these residues. Soak your broccoli for 15 to 20 minutes in a large bowl of water with 1 teaspoon of white vinegar or baking soda per liter. Then, rinse thoroughly with clean water. Studies from the University of Massachusetts Amherst show that this simple method removes the majority of surface pesticides. If you can, choose organic or untreated local broccoli. Laboratory tests show that it often contains up to 80% fewer residues. And for thick stems, peel or cut off the outer layer, as that's where the chemicals accumulate the most. Want to go even further? Add protective foods to your plate, like garlic, turmeric, or lemon. Their antioxidants help your liver neutralize any remaining toxins. Broccoli will then become what it's supposed to be, a natural cleanser, not a source of slow poison. Another mistake: eating broccoli without considering your anticoagulant medication. This is one of the most overlooked cases, and yet it has already sent many patients to the hospital. Broccoli is extremely rich in vitamin K, the vitamin that helps your blood clot. But if you're taking medications like warfarin, Coumadin, Eliquis, or Xarelto, these treatments work precisely by blocking vitamin K to prevent clots. Do you see the problem? If you suddenly eat a lot of broccoli, even thinking you're doing the right thing, you're introducing a massive dose of vitamin K that partially cancels out your treatment. Your blood becomes thicker again, the medication becomes less effective, and the risk of a clot or stroke increases. The American Heart Association observed that more than 60% of patients on warfarin showed dangerous variations in their INR levels simply due to fluctuations in their consumption of vitamin K-rich vegetables. But be careful. The goal isn't to stop eating broccoli, it's an essential food. The secret is consistency. Eat roughly the same amount each week, not 0 one day, then a mountain the next. A few simple guidelines: a portion of 50 to 70 grams, a small cup, of cooked broccoli per meal, is considered safe for most people on anticoagulants. If it's consistent, inform your doctor of any lasting changes to your diet. They will adjust your medication dose if needed. And don't forget to have your INR checked regularly. This is for your safety. Remember this: broccoli is not your enemy. It simply needs to work as a team with your medication, not against it. The next mistake: eating too much broccoli when you have a thyroid problem. Here we enter a more hormonal area, but a crucial one. After 50 or 60 years of age, broccoli belongs to the cruciferous family: cabbage, cauliflower, kale, etc. These vegetables contain substances called goitrogens. They are not dangerous in themselves, but they prevent the thyroid gland from properly absorbing iodine, a mineral essential for the production of thyroid hormones. In a person already prone to hypothyroidism, very common in women after 60, excessive consumption, especially of raw broccoli, can worsen fatigue, slow metabolism, and weight gain. A report from the American Thyroid Association showed that people deficient in iodine who consumed raw, cruciferous vegetables daily saw their hormone levels drop within a few weeks. Again, everything in moderation. It depends on the cooking method and the quantity. Steam the broccoli for 3 to 5 minutes. The heat destroys most of the goitrogens without altering the essential nutrients. Avoid green juices or smoothies made with large quantities of raw broccoli if you have a thyroid problem. Combine it with iodine-rich foods such as fish, seaweed, or simply a little iodized salt. And if you are taking medication like levothyroxine, always leave at least 45 to 60 minutes between your medication and the consumption of broccoli or foods very high in fiber. This improves its absorption. Again, it's all about balance, not prohibition. When properly prepared, broccoli can even protect your thyroid, thanks to its anti-inflammatory antioxidants. Finally, the worst mistake of all: consuming damaged or moldy broccoli. You might be thinking, oh, it's just a little yellow. I'll cut off the bad part and cook it. That's one of the worst things to do. When broccoli starts to yellow, soften, or smell slightly acidic, microscopic molds have already begun their work. These fungi, Aspergillus, Penicillium, Alternaria, secrete mycotoxins invisible to the naked eye. And the worst part? These toxins are resistant to cooking. Even boiling or frying doesn't destroy them. The National Institute of Environmental Health Sciences reminds us that some mycotoxins can cause, even at very low doses, liver, kidney, and neurological damage. They don't necessarily cause immediate poisoning, but they accumulate silently. So, the golden rule: if your broccoli changes color, smell, or texture, don't take any risks. Never just cut off the damaged part. The mold's roots extend throughout the entire head. And remember, it's better to throw away a questionable vegetable than to strain your liver for weeks. The final secret: how to keep broccoli as a true longevity medicine. After everything we've just seen, you might think that broccoli is a headache. But no, just 5 simple rules are enough to make it your best ally again. 1. Always fresh, never stored for more than 3 days, or frozen after blanching. 2. Always cooked gently steamed for 3 to 4 minutes, never fried, never boiled for too long. 3. Always clean, wash with vinegar or baking soda before cooking. 4. Always adapted to your body. Avoid raw broccoli if you have a sensitive stomach. Adjust the quantity if you are taking anticoagulants or have a thyroid disorder. 5. Always accompanied by a little healthy fat and vitamin C, olive oil, lemon, bell pepper to boost the absorption of antioxidants. You see, broccoli isn't a hidden enemy. It's a test of attention. If you respect it, it will return that respect 1,000-fold. And at your age, every well-understood meal becomes a dose of natural youth. So tell me in the comments, which of these mistakes were you making without realizing it, and which one will you correct starting today? If this video has enlightened you, leave me a little like, subscribe to Next Age Health, and share it with someone who still believes that more broccoli equals necessarily better.